Hello friends, today we are going to discuss nuclear medicine part 3, in which we will look at few nuclear medicine procedures that are performed on gastrointestinal tract of the human body and CPTs that are used to code such nuclear medicine procedures. The CPTs that are involved in coding such nuclear medicine procedures are as follow. Our first CPT is CPT 78258, which is used to code esophageal motility test. Esophageal motility test is a test which is used to evaluate the movement of food chain or food bolus from the mouth to the stomach through the esophagus. So the food chain or food bolus moves from the mouth to the stomach through a specialized movement which is known as the peristaltic movement, which is caused due to continuous muscular contraction of the smooth muscle of esophagus. And whenever there is an abnormality in the movement, or there is a decrease in the speed of the movement of food chain or bolus from the mouth to the stomach, can lead to blockage in the esophagus and can cause many other problems. So in order to prevent such problems, we are doing, or in order to detect such problems, we are performing a test which is known as the esophageal motility test using nuclear medicine procedure. And whenever there is documentation, whenever in the report there is documentation of esophageal motility or any other findings which is related to esophageal motility or peristaltic movement or movement of food from the mouth to the stomach, then we need to code the CPT 78258. Our next CPT is CPT 78261, which is used in gastric mucosa imaging. So whenever nuclear medicine procedures are used in order to image the, or in order to take the images or look at the gastric mucosal layer or the outermost layer of the innermost layer of the stomach, then we need to use the CPT 78261. This gastric mucosa imaging test is mainly done in case of in case when there is a need to detect the stomach ulcers, or whenever there is symptoms related regarding the gastric ulcers or stomach ulcers, we are performing gastric mucosa imaging test. And whenever there is documentation of such stomach ulcers, gastric ulcer or gastric mucosa imaging in the report, we need to code the CPT 78261. Our next CPT is CPT 78262, which is used to code gastroesophageal reflux study. Before learning about the gastroesophageal reflux study, we need to know about gastroesophageal reflux disorder. What is gastroesophageal reflux disorder? Gastroesophageal reflux disorder is a digestive tract disease in which the contents of the stomach, that is the hydrochloric acid and the bile juice, moves from the stomach to the food pipe. So whenever this hydrochloric acid and bile juice or any other content of the stomach moves into the food pipe, it causes a lot of irritation in the food pipe, because the mucosal layer which is present in the stomach is very thick as compared to that which is present in the food pipe. So the preventive layer, which is the mucosal layer, is present in very small amount in the food pipe. This causes this irritating acid from the stomach whenever moves to the food pipe, causes a lot of irritation. So this is inability of lower esophageal sphincter. Lower esophageal sphincter is a cover which is present, a muscular cover or muscular flap which is present between the esophagus and the stomach. Whenever there is a movement of chyme or food bolus from the esophagus to the stomach, the cover opens or the flap opens. That is, the lower esophageal sphincter open and the food chyme moves from the esophagus to the stomach. But in certain cases, there is inability of this muscle to contract or this flap to get closed during the required required time, and this lead to movement of some of the gastric content into the food pipe, and this causes a lot of irritation in the food pipe. So in order to detect this gastroesophageal reflux disorder, we are using technetium 99m sulfur chloride nuclear medicine isotope, which is used to perform nuclear medicine procedure. And whenever there is documentation of such gastroesophageal reflux disorder in the report or gastroesophageal reflux study in the report, we are coding the CPT 78262. Our next CPT deals with gastric emptying test. Gastric emptying test is a test in which is used to calculate the time taken by the food to move from the stomach to the small intestine. That is nearly 1.5 hours in maximum cases, 1 to 1.5 hours in maximum cases. But in there are certain cases in which the time taken by the food to move from the stomach to the small intestine increases. These conditions are known as gastroparesis. In gastroparesis, this time which is in gastroparesis, the time taken by the food to move from the stomach to the small intestine increases, and whenever there is increase in this time, in certain cases the food bolus which is present in the stomachs hardens and create a blockage in the small intestine, and this will lead to a lot of problem and releases many toxic gases inside the stomach, and uh, can be very lethal in certain cases. So in order to detect such gastric emptying time, we are performing nuclear medicine test to detect the gastroparesis at the early stage and provide proper treatment to the gastroparesis patient. Our first CPT which is involved in coding such gastric emptying test is CPT 78264. In CPT 78264, whenever there is gastric emptying test is documented in the report, then only we are coding CPT 78264. But in case, along with gastric emptying study, a small bowel transit and means the time taken by the food to move through or to move across the small intestine into the large intestine or the colon uh, is also mentioned in the report, or is also performed along with the gastric emptying time or gastric emptying test. Then we are coding the CPT 78265. Our next CPT is CPT 78266. Whenever, along with the small bowel transit time, colon transit time is also documented in the report. Means all the three, that is gastric emptying time, small bowel transit time, and the colon transit time. All the three are mentioned in the report. In such conditions, we are coding the CPT 78266. Colon transit time is the time taken by the food to move across the colon through the urethra. Next are the CPTs which are used to code urea breath test. Urea breath test is a specific test which is used to perform Helicobacter pylori infection. Helicobacter pylori have a specific enzyme present in it. Whenever there is infection of such parasite in the human body, this parasite have the ability to convert the urea into ammonia and carbon dioxide. So whenever a radio-labeled ammonia is ingested by the patient with the Helicobacter pylori infection, the Helicobacter pylori reacts with the urea and releases gases like ammonia and carbon dioxide. And whenever this radioactive carbon dioxide is detected out through the patient's through the carbon dioxide released by the patient, then we can easily detect it and provide proper treatment to the patient. Whenever urea breath test is mentioned in the report, we are coding two different types of CPTs. One is CPT 78267 and another is CPT 78268. The first CPT is used when is coded when acquisition for analysis is done, and when actual analysis is done, we are using the CPT 78268. In certain cases, there is excessive blood loss, internal blood loss in the gastrointestinal tract, and whenever there is a gastrointestinal blood loss imaging is done, or gastrointestinal blood loss imaging is mentioned in the report, we are coding the CPT 78278. Our next CPT is CPT 78282. Whenever there is gastrointestinal protein loss imaging is taken, or nuclear medicine procedure is used to detect out the amount of protein lost by the gastrointestinal tract, we are using the CPT 78282. Our next CPT is CPT 78290, which is used in order to check the mucosal thickening of the gastrointestinal tract. So it is different at different sites, but it is most commonly used in order to detect the gastric ulcers or any kind of ulcer which is present in the gastrointestinal tract. It is also known as Michel's localization, or it is also used to check out the volvulus, which is most common in the colon. Our next CPT is CPT 78291, which is used to check the potency of peritoneal venous shunt. Peritoneal venous shunt is mostly used in order to deliver or in order to transfer the liquid that is accumulated in the peritoneal cavity, that is most commonly known as the ascites. Whenever this ascites is transferred through a specialized shunt into the superior vena cava, then such shunt is known as peritoneal venous shunt, and whenever potency of such shunt is tested through using nuclear medicine procedure, then we are coding the CPT 78291.